Management of hyperthyroidism. Regarding one questions of MCQ, which one of the following drug does not impairs the conversion of T4 to T3? Which one of the following drugs does not impairs the conversion of T4 to T3? Without any options, distractors, the answer is methimazole. As we know that the the drugs which does not impairs the conversion of T3 to T4 to most biological active form is T3, and without any distractor you are able to answer the drug is methimazole. Methimazole, which does not impairs the conversion of T4 to T3, and in the drugs which impairs the conversion from T4 to T3, it includes propyl thiouracil. I will abbreviate as PTU, propyl thiouracil. This is common one. You are already know about this. The drugs which does not impairs the conversion of T4 to T3 is methimazole, and which impairs the conversions are the propyl thiouracil. But if there is some distractors, including propyl thiouracil, propranolol, the first one is propranolol, if there is options including propranolol, amiodarone, amiodarone, and the dexamethasone as a steroid. Now, if the question with these five distractors, methimazole, propyl thiouracil, propranolol, amiodarone, and the dexa. And question is, which one of the following drug does not impairs the conversion of T4 to T3? So does not impairs the conversion means it facilitates the conversion from T4 to T3. Most of the student may answer propranolol is the drug does not impairs the conversion of T4 to T3, because propranolol it is generally we are using in the hyperthyroidism patient for the symptomatic management including anxiety, arrhythmia, tremor, and palpitation. To manage the symptomatic condition, propranolol is not clinically indicated for the treatment of hyperthyroidism. But in the off label, we can utilize propranolol to manage the symptoms which is caused by the hyperthyroidism. So which we are generally using propranolol for the symptomatic treatment, anxiety, tremor, and palpitations. And but some studies found that if we are using propranolol in the dose of 160 milligram per day, may inhibits the conversion of T4 to T3 if the dose is 160 milligram per day. So regarding the propranolol, our question is does not impair the conversion of T4 to T3, and you are well known that the only methimazole is the drug which that methimazole is the only drug which does not impair the conversion of T4 to T3. And some student may answer propranolol because it is symptomatic use. So propranolol is not impairs the conversion of T3 and T4. But if the dose is 160 milligram per day, it will impairs the conversion. Remember, it will impairs the conversion. Regarding amiodarone, as we know that it is the indicated for the treatment of the arrhythmias. It is indicated for the treatment of cardiac arrhythmias, and uh, this amiodarone may leads to hypothyroidism and hyperthyroidism. But also again, the amiodarone due to iodine content, amiodarone has the iodine content, it may impairs the conversion of it may impairs the conversion of T4 to T3. So I will use this red mark. It may also impairs the conversion of T4 to T3, and propanol also impairs the conversion of T4 to T3 in the higher dose. Next drug is dexamethasone. As we know that dexa is a steroid and it is not the indicated for the treatment of the hyperthyroidism, dexamethasone. But dexamethasone is also in the higher doses near about the 2 milligram every 6 hour. Every 6 hour may impairs the conversion of T4 to T3. So distractors here, distracts are three distractors are propranolol, amiodarone, and dexamethasone. In higher doses, these drugs may impair the conversion of T4 to T3. So if there is a question, same, which of the following drug does not impair the conversion of T4 to T3? The right answer is methimazole. The drugs which does not impair the conversion of T4 to T3, and other drugs including propylthiouracil may impair the conversion of T3 to T4 to T3. Propranolol in higher doses, 160 milligram per day, impairs the conversion of T4 to T3. Amiodarone also impairs the conversion of T4 to T3, and dexamethasone in higher doses, including 2 milligram every 6 hours, may impairs the conversion of T4 to T3. I hope this explanation will get your doubt clear. Salam alaikum. Thank you very much.